Hey guys, we are back here at Atlantic Health System, home of Atlantic Sports Health. I am here with Dr. Chloe Zeltmann, and she's a doctor of physical therapy. We're going to talk about blood flow modification, more specifically, blood flow restriction. Chloe, what exactly is that? Can you explain to our audience
Sure.
what blood flow restriction is?
Sure. It's kind of a new training technique that started in the 90s but kind of blew up, just like you said, recently. Basically what it is you occlude your venous blood supply and partially occlude your arterial blood supply to kind of trick your body into thinking it's working harder than it is. So you would apply some sort of restricted cuff measure, something like that, to your desired pressure, and then you would work out while you have that cuff in place.
Wow. And how is this used in physical therapy?
So physical therapy, we use it a lot in our rehab populations post-surgically. So after you have an injury, after you have surgery, and you're really restricted in what you can do while all the structures are healing, you can't necessarily go work out as hard as you can. You can't necessarily jump on a leg press or lift up, even a 10-pound dumbbell.
Right.
So what we're running into is people are atrophying over the 6-week, 8-week period, that their muscles are recovering, or their tendons are recovering, or their ligaments are recovering. And then not only do we have to fight with getting back range of motion and getting them back to their normal function, we're also fighting against decreased muscle strength, muscle atrophy. So we can apply these machines onto these people who are still really restricted. They can do basic, simple exercises, ankle pumps, knee extensions, bicep curls against no weight at all, so they're not breaking any restrictions, and they can maintain their muscle function. So it's actually really helpful in the rehab population.
Wow, very, very interesting. So basically, you're restricting the blood flow to that muscle.
Correct.
Which is causing the muscle to have a training effect a lot more intense than it actually is.
So what it does is it kind of tricks the body into thinking you're working out really hard. So normally when you're working out, people experience that burn feeling, and that burn feeling is a decreased oxygen because you're working out so hard, the blood is not able to pump enough oxygen. You get decreased oxygen, and that kind of sets a physiological effect that we know for normal muscle growth. The muscle breaks down, then you have a bunch of factors that come in that stimulate then muscle growth. So what the machine does is it restricts that blood flow, similar to a way if you worked out really hard. So you're kind of tricking the body.
Sure.
And then therefore you go through that similar pathway of muscle breakdown, but you don't get any muscle breakdown. That's the key.
Right.
So there's no muscle breakdown, so you don't get any of that annoying soreness the next day, and you're still getting that muscle stimulation, that growth.
Wow.
Yeah.
Fascinating. It really cutting edge that you're doing that here.
Yes.
Atlantic Health.
We're really lucky.
In the physical therapy department.
Yeah.
And I know, just general population have starting to take advantage of
Correct.
this.
It's not just rehab. You can use it for training purposes again. If you want to cut down, say you're training for a competition and you want to work out 5-6 days in a row. Obviously, conventionally, you can't do that because you have to give certain muscle groups a chance to rest.
Right.
This allows you to still work out and still make gains without having to go through that rest period.
Awesome.
Yeah.
Well, I look forward to trying it in our next segment. We're going to actually do a live demonstration of this technology, and come and check us out, because as we continue to share more information with you, we're going to continue to learn more about how this blood flow restriction really works. Chloe, thanks so much.
Of course.
Appreciate it.
Thank you.